future is coming, ready or not. And I prefer, and I think most people prefer, that we be ready for it. And that means assuring that we have the people with the skills for the jobs, not just of today, as critical as that is, but of tomorrow, and anticipating that rather than trying to catch up, as we so often do. Industry is evolving rapidly, and we want to be ready for it. And you don't have to be a Democrat or Republican to understand that being ready for it means caring about and preparing the workforce.
For a while, we had a really good conversation going in this country about the American workforce, about what works and what doesn't in education. And now, ironically, as we've learned more and more about what really works in education, there's far less discussion on the political level, whether it be executive or legislative branch, about how we make certain that actually happens in our schools. And we see the results of that. We saw some disastrous NAEP results come out recently. And we know that all translates into people not being ready for the workforce. So this is that critical issue that unfortunately we're not talking about anymore. While the right and left are far apart on so many issues, this is one of those, making certain that everyone, regardless of income level, regardless of background, has an equal opportunity to have a shot at a great job. You know, where are you going to find the political difference in that? Now let's go talk about how we do it. And that's why I'm excited about this commission. We're going to talk about how you actually do that.
BPC created the Commission on the American Workforce to bring together stellar leaders from across the continuum, because we know that our economy can't grow, our country can't prosper unless we all come together around the talent pool of our citizens. That's why we're here. We all share a belief that without a high-quality education, you cannot be successful in work, in life, in your community as a citizen. And that's something that we all share, and why we're working so hard on these issues, to bring urgent action around the needs of the American people.
Almost every time you see an analysis of the future of American prosperity, it begins with the realities of having a trained, capable, productive workforce. And that's true not only at the national level, but at cities and counties and states, everybody pulling together to get the maximum we can from the quality of our workforce. This is the main play for our country. And our economy will only suffer, our competitive position will suffer, if we don't work hard to generate the absolute best workforce that we can.
Good afternoon, and thank you all for joining us. I'm Melinda Garrett. I lead the Working Families portfolio here at BPC. I'm very excited to welcome you all to our 5th event in the America's Workforce Solutions Beyond the Gridlock series. Today, we're focusing on innovative solutions in childcare financing at the state level. We know that access to affordable, quality childcare is foundational to a strong workforce and a thriving economy. And yet for too many Americans, access to reliable childcare remains out of reach. It limits a parent's abilities to work and places pressure on employers already facing labor shortages. Today, we'll learn more about how 2 states in particular have stepped up to address this challenge by creating bold, new, sustainable financing models that strengthen their childcare ecosystem and help access and outcomes for parents, employers, and the economy. We're very fortunate to have the interim commissioner of the Connecticut Office of Early Childhood, Elena Trueworthy, and Sherry Penny, the Child Care and Development Fund Manager for the Iowa Department of Health and Human Services, here with us today to share about these innovative models. And moderating this conversation is Susan Neely, the CEO Emeritus of the American Council of Life Insurers. Susan is also a member of BPC's Commission on the American Workforce. Susan, thanks so much for leading today's discussion, and I'll hand it over to you to take it from here.
BPC for convening this commission and identifying one of the critical issues that has to be addressed if we're going to be a competitive, economically successful country going forward, and that is childcare. It's really, we're going to have a great conversation today with our 2 experts who are driving solutions out there, and I think it's such a important, meaty topic because we can really look at it through 2 lenses. One lens is the family situation itself, If you are not confident in your childcare, how do you get educated? How do you go to work? How do you get training? It's been a few years, but I think a lot of us know that moment we have as new parents when you realize that the whole operation is resting on your confidence and your accessibility to good childcare. So that's the family lens. Then the macro lens is the consequences for our economy, our communities, our country when we don't have educated, trained, sufficient human capital to do what we need to do to be competitive. So we're going to look at all of this today. The good news is that there is bipartisan recognition, I think, across the board at the state and federal level about how critical this topic is. And we all know when there's a will to address something, ultimately we'll find a way. We have two great experts today to talk about ways that they have innovated in their states. So let's get to it, Sherry and Elena. Before I do that, though, one housekeeping, thank you for all the questions that came in advance. We've done our best to incorporate them into the discussion we're about to have. And if you find, as you're listening to our two panelists, that you have additional questions, you can use the live chat on YouTube or on Twitter using a hashtag America's Workforce, and we will make sure to get to those questions and keep this interactive as we get toward the end of the discussion. So here we go. Sherry and Elena, let's start first with the why, and then we'll delve into the how you're doing what you're doing. But let's start with the why. What was the landscape in Iowa and Connecticut? What were the challenges you were seeing that prompted you and state leadership to try to figure out a solution? Sherry, we'll start with you.
Thank you. Thank you so much for having me. I would say that in Iowa, we were and continue to face many of the same challenges that other states are facing. This isn't necessarily unique to just Iowa, but those challenges included a lack of childcare availability, childcare cost for families, low provider wages. And while this isn't unique to just Iowa, as I mentioned, I'm really proud of the work that our state leaders have done for many years to stabilize the childcare crisis. And those include several things that we'll talk about today, along with the grant opportunities for infrastructure, increasing FPL, CCI pilots, and so much more. Because it isn't really a one-size-fits-all. It's going to take a lot of systems to create a sustainable solution for childcare.
Thank you. And Elena, what was the picture from your perspective in Connecticut? What challenges were you seeing?
Great. Thank you, Susan. It's so great to be here. And I first want to thank BPC for your work, because a lot of your work we've taken in Connecticut and has helped inform what we do and what we're doing today. So back in 2023, Governor Lamont, through an executive order, issued and created a blue ribbon plan on childcare. So this was a diverse table that came together, and his charge to that panel was to identify the challenges happening across our state related to young children and their families, specifically about childcare, the workforce, and to come up with a 5-year strategic plan that really identified specific strategies to work on those issues. And so through the Office of Early Childhood, we were created back in 2014, where we brought together 5 different funding streams from different agencies together into a cabinet level agency called the Office of Early Childhood. This allows us to have kind of one voice, one vision when it comes to early childhood and preventative services across our state. Our office works on childcare issues, but also home visiting. We run the Childcare Development Block Fund, CCDF, and also major quality initiatives. So throughout the work of the Blue Ribbon panel, we went out to do a lot of listening from both the field and parents and philanthropy and other stakeholders. And much of what Sherry just mentioned is the same here in Connecticut when it relates to affordability, access, and quality. And what we heard from families is that it's just very difficult to find childcare and the type of childcare that they need and want that really relates and aligns to their working schedule or their higher ed schedule. There's also not enough teachers, right, in the field and the workforce around retention and recruitment is challenging as well. And that really, is a burden on programs to be able to be sustainable and to grow. And also the childcare system is very confusing for families to navigate. And so, through the work of Connecticut, we have worked to identify strategies to work on these issues.
Well, thank you. I think you all do a good job of laying out the landscape and the challenges that drove your leadership, you as leaders, to take action. I'm hearing it was a multi-year commitment, and it's a multifaceted solution. I want to highlight here, as we're talking about challenges, some important research that BPC and its partners did that identified, actually, nothing like numbers and data to crystallize what we're talking about here, that America faces a childcare gap of almost 4.2 million kids without access to a formal childcare slot, and that these gaps in access could cost the U.S. economy up to $329 billion over 10 years. So $329 billion, 4.2 million kids who lack a formal slot. I think that helps crystallize what we're talking about, that this is a nationwide crisis, really. And again, we're grateful to these state leaders for sharing what they've done to step forward and try to address these issues. So I will launch the statewide Child Care Solutions Fund. Connecticut established an early childhood endowment. Can you each walk through these innovations, what they're designed to do, and in particular the financing streams? Because this does require an investment, and there's a lot of complexity in addressing the issue of access and affordability to childcare, but starting with the dollars. How did you figure out how the dollar should flow, and what were the outcomes they were designed to address? Sherry, you went first last time. I'll move to Elena to go first this time.
Sure, thank you. So this past legislative session was truly a historic one for Connecticut, and thank you to the leadership of Governor Lamont and also the partnership and leadership of the legislature, including the House and the Senate. But this was really a win for all. There were so many groups and partners who contributed and were a part of this success that we've had. And it's also about the Connecticut Early Childhood Education Endowment, but there were two other bills passed as well to make more of a comprehensive approach to childcare access, quality, and our workforce. And so I'll talk through a little bit about each of those. The Early Childhood Education Endowment basically takes the state's unappropriated budget surplus each year and invests that into the endowment. So prior to the close of each fiscal year, those dollars will be identified and invested into the endowment. So for example, this year, $300 million was invested as the first time investment into the endowment. Now, the endowment depends on future contributions, and for this to happen year after year, creating that long-term sustainable funding stream. There are also in the law rules, right, around how what percentage of the dollars can get spent and what they can get spent on. So in the first year, we are allowed to expend 12% of those dollars, or approximately $36 million, to be used in the field and to build up the capacity within the system. In ongoing years, that goes down to about 10%. In addition, we're allowed to use the dollars on three main buckets of work. That includes expansion costs. This can include higher provider rates, increased slots and access. And it's important to note that at least 35% of any new spaces that are expanded within our state-funded childcare system, called Early Start Connecticut, must go towards infants and toddlers. This was a really intentional purpose to ensure that our whole birth to 5 system stays stable and is able to grow together, and to best meet that demand that we were hearing so much from families about the demand that they have for high quality care for their young babies. In addition, we can use dollars towards programmatic costs and administrative costs as well. What's exciting about the endowment is that these first 2 years are really geared towards planning and capacity building. So that beginning in July 1, 2027, through our state-funded program, Early Start Connecticut, we're able to offer free childcare for families enrolled in those spaces who are earning less than $100,000 per year. Above that, for families who are earning more than $100,000 per year, their contribution will be 7% or less. So that really speaks to the affordability for families. In addition, the endowment is kind of advised through an advisory board that is appointed. It's also administered, the dollars are administered and invested by the Office of the Treasurer. And that advisory board is tri-chaired by the Commissioner of the Office of Early Childhood, a member of the House, and a member of the Senate as well. So the endowment really speaks to how to build the system and have a focus on centralizing child and family voice and the role of local governance. In addition to the endowment this past year, 2 other bills were passed that really talks to the comprehensive approach for the early care and education system. There are pieces in there around creating a healthcare subsidy for the early childhood workforce, along with bond funding for facility improvements, construction, and renovation. So as you can hear, there are a lot of pieces within the system that these bills and the endowment is looking to address and is addressing.
There's a lot of pieces and I guess a lot of checks and balances to make sure that the funding is directed toward the identified priorities. Is that right? And is there an vision that at some point the endowment could become self-sustaining, or is that way down the road?
So that's a conversation we're currently having. It was actually a first question to the treasurer at our first advisory meeting. So yes, I mean, the goal is that we have a long-term sustainable solution for funding, which really speaks to, you know, addressing the root cause of how our early care and education systems have been financed, right? It's been a patchwork of, you know, financed opportunities or ways in which different funding streams can come together. And it really speaks to a lack of stability within the field when you have that. And so what we're really looking to do is to be able to say to the field, you know, you matter, right? You, your teachers, workforce, you matter. We want to make sure that you are receiving the compensation, right, that you deserve, that your program has the funding to be stable and to be able to grow, and for families that you have what you need in order to go to work, right? In order for your child to develop and be in a very nurturing and high quality environment.
Very good. Well, a big vision that's beginning to be implemented in Connecticut, and also a big vision that is beginning to be implemented in Iowa. So Sherry, we'll turn to you. The Iowa's Child Care Solutions Fund, an example of a public-private partnership with public-private partners matching private funds. Tell us more about what's happening in Iowa.
Yeah, absolutely. So in Iowa, we saw success with a 2020, end of 2023, early 2024 pilot program of child care solution funds, which were the public-private funding model. We launched this pilot with 10 selected communities who all had the capability to house this fund under a local economic development or chamber office. And the communities were defined by the individuals on the ground. Some did this countywide, some did this citywide, and then this will lead us into our statewide conversation. So thanks to our innovative state leaders, we were able to secure $2.5 million in ARPA funding for these initial pilot communities. These 10 communities were able to apply for funding via an intergovernmental transfer as a match to the local business contributions. Technical assistance is key, and this was provided to engage local employers and provide the ask of those employers of $150 per employee per year for at least 3 years in order to gather enough data. The ARPA dollars then matched the local business funds 2 to 1. The local solution funds created a task force of community stakeholders to create their local program parameters and decide how much to increase their wages locally. The ARPA dollars were spent first, and sustainability in year 2 is now coming from the local city and county governments, utilizing funding streams such as TIF and LOST. So now in year 2 and year 3, local city and county government are taking the place of that state ARPA investment, since those dollars were spent down first. There is no longer a state investment locally. However, the state has now opened up the statewide solution fund to overcome the hurdle of corporate contributions. That is a direct result of this pilot program that was run in these communities. All of our pilot communities saw success of stabilized child care workforce and averaged 22 new child care slots per 1,000 children. The outcomes that we are continuing to see in year 2 include the stabilized workforce, more open child care spaces, and the potential to lower the cost of families due to this operational gap funding. Our report that Common Sense Institute put out for us of what a statewide child care solution fund could potentially look like for the state of Iowa included adding nearly 11,000 new registered or licensed child care spots across the state. This could potentially enable about 5,000 women to enter the workforce. It will expand Iowa's GDP by $13 billion over 10 years and has the potential to increase statewide personal income by $6.1 billion over 10 years. So you can see the writing was on the wall to launch the statewide solution fund, which is really going to start to engage our corporate leaders. And I'll talk about that as we continue our conversation.
Well, $13 billion to the state's GDP, that's the kind of number that I suspect gets the attention of both the business community and elected officials. So kudos to you for putting the data out there. When we were talking in advance, preparing for this conversation, I did ask Sherry, well, where was your pilot? Coming from Iowa, I have a sense of the state, and it was a very, very comprehensive pilot, I would say. But can you talk more about how you made sure that you were listening to local concerns as you were building the program and using the pilots to figure out how to make this all work effectively?
Absolutely. A key component of that is really looking at the local data. So while we allowed these communities the opportunity to kind of build the solution from the ground up, all of these communities, which varied in size, varied in rural versus urban, city versus county, it's going to look different in every landscape that you have all across the state. And so it was important to keep the local control for each individual pilot communities. And also that was a way to engage our employers. And also, as we go into phase 2, getting those city and county leaders to invest. It's a lot harder sell to get the city and county leaders to invest their dollars if it's not going to be staying local. Also, if you're running into things where with a statewide program, we allowed them to set the parameters and focus on their local data in what the needs were. And in all 10 of our communities, it was a workforce issue. It's increasing those wages. It's that operational gap funding. And so we really had to make sure we worked really hard with our state leaders to understand that this cannot be something that the state is going to push out, but it needs to be homegrown from the ground up.
And Elena, talk more about that from your perspective in Connecticut, and specifically, how did you think about integrating the endowment with existing childcare and early learning systems?
Great question. So where I started at the beginning of this conversation was the Blue Ribbon panel and the Governor Lamont's when he pulled that together. So part of the whole grounding of this work is that Connecticut, we said, it is really important that we understand the true needs and wants of families, of providers, and of other stakeholders across our state. Connecticut is a small state, but very diverse in its income, in its languages and ethnicity, and in its needs geographically. And so we set out on a listening campaign with the support of philanthropy and the advocates, all together at the table, going down to the ground in communities, holding listening sessions virtually in multiple languages, to be able to have people share their voice with us as to the different areas around access, quality, and affordability. And from there, that was fed up to the Blue Ribbon panel, who then was able to take that and create a set of recommendations and a strategic plan that focused in these areas. Also at the table, what was really important was the business community, and we made sure that we got ample feedback and input from families. At the Office of Early Childhood, we have a robust OEC parent cabinet that helps advise us on the best way in which to get parent voice to the table. And for philanthropy, this was a really important piece that they supported in Connecticut to make sure that that happened. So it was a combination of both the qualitative feedback from those listening sessions and also looking at data and the support of partners such as social impact partners that help to pull that data together for us to be able to make a case around why these strategies were so important to implement and what the return on investment would be.
So data and listening and data. Sherry, you've alluded to stakeholder buy-in and how much time and effort was put into that. Talk to us more about what else you all did to get the buy-in that you needed from all the policymakers, agency officials, childcare providers, businesses, and of course, families themselves.
Yeah. So with our pilot solutions, we quickly saw that sustainable success was being built from the ground up, as I mentioned. This was the key to keep those local businesses engaged and local government leaders investing, while also utilizing the child care data to make informed decisions on the solution fund structure. So our state leaders quickly recognized through technical assistance, project management, and data collection that our business leaders were willing to do something but didn't have the time or manpower to create a position to really carry out this work. By having a project manager who was funded by Iowa Economic Development Authority, we were able to show the need, talk about that ROI, return on the investment, handle the implementation while only asking $150 per employee from local business leaders and also to those corporate investors. The cost is less than a typical benefit for most employers. So the solution funds were tackling a big part of the crisis, which is stabilizing that workforce without taking on the bulk of the operational gap financing. Iowa Solution Funds, everyone has a role in the success, and keeping it local allows for the community leaders to use data-informed decisions. This allows our state to focus on providing things like technical assistance, resources, and data analysis, or data analytics, while also maintaining other provider-specific free supports like our CCA pilots, increasing the FPL, business coaching, professional development. The list goes on and on.
So you both talked about an extensive process to get buy-in, and that clearly has been essential to getting these efforts launched and moving forward in the productive way that they are. Just zoom in a little more on how does all the buy-in get synthesized? Buy-in is great, but it can also be paralyzing that we've got so many different points of view, we can't move forward. So what's your governance structure? How are decisions made? How does input come in real time for mid-course corrections as you go along, and then to figure out where you're going the next year? Either of you, feel free to speak to this first.
Sure. So at the Office of Early Childhood, really that continuous feedback loop and that two-way communication with the field and with families and our agency is just core to how we work. We really learned that through the pandemic, that we needed to have that feedback loop in place at all times. And so we look to do that throughout the agency. We also learned a lot through the Blue Ribbon Panel planning process. And what the field and other partners really told us is that they really wanted to be step by step in the process with us. And so that required us to be very transparent in sharing what we heard, how then what we heard was actually implemented and is visible in the changes that we were then putting out after we synthesized that feedback that came in through that process. So transparency is absolutely key to getting feedback and to getting trust, because people can see that you're listening, but you're not just listening, you're taking what you're hearing and you're putting it into action. In addition, communication ongoing is very important during processes like these. When changes take place, that you're communicating that, right? You're communicating when convenings are taking place with ample time, providing multiple opportunities for people to come to the table. And also when you can't take or don't take feedback, you really explain why. Right? It could be a timing issue. It could be that it just doesn't align with the goals right now. But having that common goal and setting that common goal and vision at the onset is critically important, so that everyone's at least marching towards that same goal and vision. And I think just tying it back to our state-funded early care and education system, that was something that we heard throughout the pandemic, and also through our listening sessions, was that all these multiple different funding streams that early care and education providers work with is very challenging. Some can have different eligibility requirements, right? Parents can qualify for different programming. So all of this is really burdensome on the program. And so what we were able to do in Connecticut through legislation, because of what we heard in the feedback, was that we took 3 disparate funding streams for early care and education, and we combined them into one. So our new program with these combined funding streams is called Early Start Connecticut. And what we also heard is to build upon that system, to not reinvent the wheel and do something new, right? Or start a different program, but really when the funding comes in from the endowment or other sources, that we're strengthening and building out that state-funded system so that people come along with that pathway and continuum to being able to be a state-funded provider and to be a part of our system.
And Sherry?
Yeah, I really have to echo a lot of what is happening in Connecticut. For Iowa, again, I love when you say not reinventing the wheel. That's been a really big part of the conversation in Iowa, is just understanding what is being mentioned, what is being prioritized, and making sure that we all have that same collective goal. Because at the end of the day, we all have the same goal, but how we're talking about it varies so differently. So really kind of collecting all of the voices and stakeholders and really having a clear, concise messaging for the state leaders, for our legislators, so that they can understand the root of the problem. For us in Iowa, how we're tackling that, we really utilize our child care resource and referral. We have community development specialists that are regionally all across the state who are there to kind of be that front line of communication for any community looking at or talking about child care. They're really there to say, let's sit down, let's talk about what is happening, let's look at local data, but let's also make sure that we have the right people at the table discussing what a solution looks like, and more importantly, that we're keeping quality and sustainability in mind, because those are absolutely crucial. We also utilize other contractors through our state with Iowa AEYC, CCR&R, like I mentioned, First Children's Finance. So there's so many different structures that goes into it, and really bringing all of them together to make informed decisions at the local level and then elevating that up to our state leaders. Another thing that we really do in Iowa is we're really prioritizing childcare as an economic issue. And that's a direct result of our governor's task force that came out in 2021, where she really assembled a lot of the right stakeholders, business leaders, community leaders, childcare providers, parents, to really talk about what is the root issue and how do we tackle this. And so that task force had all of these wonderful recommendations, which has led us so many years down the road now here to some of the success by breaking down those state silos. All of us work so collaboratively with Iowa Economic Development Authority, Iowa Workforce Development, the Department of Education, because we want to make sure that by creating solutions, even at the local level, we aren't going to crumble another system that's already in place. And even more importantly, making sure that any solutions happening on the ground are not duplicating already existing state investments. I think that's the biggest lesson that we learned. That technical assistance piece is having someone in the room saying, yes, that's a great idea, but let's remember, we already have that as a state-funded support that's in place, for example, preschool or anything like that. And so making sure the right people are in the room, and that really comes down to that technical assistance that in Iowa we really push out through our community development specialists.
Well, for everybody listening, watching this discussion who's worked in policy, you, I think, are probably marveling like I am at the complexity of what they're undertaking, and because of the need for integration with so many critical players. So I just hats off to you all. And as a policy nerd myself who spent some time at the state level, I appreciate how vital it is that you're doing all that you're doing and still getting something done. And I've heard you both say that the tone from the top, that you had governors who identified this as an important economic issue for your states. And then that establishes, as I like to say, the political will. We're going to get something done, and we're all going to hang in there till we get moving. So I'll just ask you one more question in this area of stakeholders with my business employer hat on. Are you hearing from business leaders that this becomes a valuable recruiting tool, that they can help bring employees into your state because they can say, we get it here, supporting our workers through childcare is an absolute priority for us, and you can assure that you'll be supported. What kind of feedback are you getting from business leaders?
Well, I can tackle this one first. This was probably my favorite part of what we're doing in Iowa, is really engaging our business leaders. It was very quick to see that business leaders all across the state very much understood that childcare is an economic issue and that it directly impacts their workforce recruitment, retention. Because if we don't have quality childcare open and available, you aren't going to fill the workforce. And so one thing in Iowa we really look at is that this isn't just a blue or red issue. It's non-political, as we always like to say. It's bipartisan, because this is affecting everyone. Childcare is not just a parent issue. It's not just a provider issue. This is an everyone issue, because regardless of the workforce, if you are not able to attract and retain those workers and get them to come into your community and put down roots, you aren't going to need the things like houses, school districts, jobs, all of those great things. So really understanding that childcare is foundational to having people move into your communities, put down their roots, purchase their homes, put their children in your school district, shop in your local areas. And so one thing that we really do is, the business leaders quickly said, we get it, we love this, and we see how this impacts us to getting in our qualifying workforce in our doors, but we just don't have the capacity to take this whole issue on. Childcare is so complex, and not only that, there's so many structures in place that it's impossible to necessarily fix everything with the wave of a magic wand, as I like to say. But instead, what we can do is just take a little piece of it, rely on those experts that are already in the childcare field, because we don't expect our business leaders to be childcare experts. In fact, we really prefer that they aren't. Let's rely on the experts that are in the field to help us make sure that we're on the right track, and that what we're doing is going to have a great ROI for those business leaders, for our community leaders, increasing our tax base in those communities, especially when it comes to rural communities. And they understood that, but they just continued to say, it's so much work. It would take an entire person to field this work. How can we get over this hurdle? And so that's where the state stepped in and said, we will fund this technical assistance piece through Iowa Health and Human Services and Iowa Department of Economic Development, to say, we will take all of this off your plate. All you have to do is invest. We will collect the data to show your story. You can communicate that up the chain. And that's really how the concept of the statewide solution was built. Those corporate leaders said, we love this, but we have a workforce that spans all across community lines, even across state lines. So how can we invest, get that charitable contribution, but also not have to be so in the weeds with it, because we don't really understand the entire crisis. We know that the experts know what's needed, and we don't want to step on their toes. So the state said, wonderful, we'll provide that help for you, give you those resources, and continue to make sure that those same supports are still in place for all of our providers as well.
So a great example of how listening helps you figure out what the role sort is and what the state could do that would be uniquely valuable to add to create the synergy you needed to move forward. Elena, your thoughts on this?
Yeah, no, I mean, Sherry said it so well, which is the importance of having business at the table, and how the childcare workforce and the supply of childcare spaces really strengthens our state's economy. And that is really a perspective of Governor Lamont, and an important piece to ensure that these connections are getting made. And, you know, there was a silver lining, right, during the pandemic, with so many terrible things that happened during COVID. But one of the silver linings that came out was really the important role of childcare related to people being able to go to work, right? People being able to seek higher education or workforce development opportunities. And so this really got highlighted when businesses during the pandemic, said we need our employees, we need our staff to be able to come in to be able to work. And so childcare was looked at as a service to be provided during that time. And Governor Lamont stood up initiatives for childcare near hospitals to ensure that hospital staff would be available to be able to treat their patients during the pandemic. So this has carried through, over the years from then until now, and business is at the table, right? Having these conversations with us, helping to design the expansion of our early care and education system to help meet the needs of businesses across the state, while also balancing and ensuring that we're always keeping the goal in mind that it is about healthy, thriving children who are going to be our future workforce. And so these two kind of messages play parallel together and come together to really create a strong argument and reason as to why it's so important to have a high quality workforce and supply that's able to meet the needs of families.
So, Elena, you do such an articulate job of describing the benefits to families, to children, to the business community, to the state. How is the endowment measuring the progress on all these fronts where you are beginning to see success, outcomes around your stated goals?
Sure. Well, this is definitely an area of work in progress, right? So the endowment was just basically established this past July. So we are very new in our rollout and implementation of what the endowment is, how it's growing, how the funding will be used, and what outcomes we're really looking to achieve. We are set out estimating that the endowment, by the year 2032 will create an additional approximately 20,000 new state-funded childcare spaces across our state. And so looking at the data and taking baseline of where we are now and being able to track that into the future. As part of the legislation for the endowment, the advisory board is required to complete an impact analysis report in the year 2032. So we're actually engaging in those conversations now as to what are the data points that we need to start collecting now, what are the outcomes that we're looking to achieve in the future, and how do we make sure that we're building the steps and doing implementation in order to achieve that. But basically, Governor Lamont and others want to make sure that we're working towards universal preschool and universal access to childcare, high quality childcare, which I think is really important. It's not just about creating new seats, right, and spaces. It's about ensuring that those spaces are high quality, that are being expanded. Also, just an important piece that I do want to mention is that we really ensuring that parent and community voice are centered to our work. So there is a big piece around the creation of local governance partners and systems down at the local level. I think Sherry spoke a little bit to this, that it's so important, right, that communities know their communities best, right? Each community is a little bit unique. And so really bringing partners together at an early childhood table and serving as a hub for families, for partners, both state funded and non-state funded, to come together to assess their local data, to identify the needs and be able to create an action plan to help identify those and work on those holistic needs of children and families at the local level. That information will get shared up with the Office of Early Childhood for us to, be informed as to how we best can use the funding, how we should be dispersing it, and where the most needs are too.
Very good. Well, I want to get to a couple other critical topics related to the models that these innovations you're putting together, and then we'll take some questions from our audience. But the other important topics, one is parent choice. And we know parents want access, they want affordability, they want good quality care. But how did you make sure that the approach you were taking wasn't narrowing the choice, that you were in fact supporting a mixed delivery system of care? Sherry?
Yeah, that was an area where we really honed in on with our pilot solutions, was understanding getting that feedback from the business leaders. Before we could ask any business leaders or community leaders to invest, it's looking at the data. And part of that included surveying their workforce for the business leaders. And what we quickly learned is that when a business leader is going to put out a survey to understand what is the child care crisis that their workforce might be facing, one thing that we quickly learned about is that yes, cost was one of the most important things that came back from these surveys of employees, but really it was parent choice. That was actually number one to our business leaders, which surprised a lot of people, I think, in the room. Also, I could get in a whole other tangent about how our business leaders, first and foremost, don't even understand that childcare might be an issue for their workforce, because nobody is going to the CEO and talking to them and explaining that they're having a childcare crisis or struggling to get to work. So by having them fill out these surveys, they quickly saw the needs and what it was that their employees wanted. And first and foremost was that parent choice. And that's where the idea of the solution funds came from. It's because it's operational gap funding for a specific community area. And so we're really keeping parent choice in the forefront, because that could be your home-based providers, your center providers. It could be a whole gamut. It's up to the community and that local solution fund to be able to determine what is the need in their community based on that data.
Lena?
I'll just jump in and say that I love the synergy between Iowa and Connecticut when it comes to really looking at the local data and having the local experts really be informed and identify what are the true needs within their local community, and really making sure and ensuring that family and their voice, right, and what they need and what they want is center in that discussion and in those decisions. In Connecticut, we started inviting in family child care providers into our state funded system back in the 2022-2023 years for the very first time. What we've heard is that such positive feedback around what a game changer it is for family child care to be able to receive state funding on a continual and sustainable basis, and for them to be wrapped around all the state funded supports that are available. But also in Connecticut, we make sure that the mixed delivery system is inclusive of all, including family child care, center-based, group home, and also schools as well.
And then I'll raise the other critical topic of early education workforce and ensuring that you have availability of professionals who can help deliver the need. How are your financing models? How are you addressing that? Sherry, I'll start with you, and then we'll move to Elena.
Oh, that's a really great question. I feel like that's kind of the million-dollar question. For one, really our solution funds right now are just primarily focused on stabilizing that workforce, getting the workers and paying a livable wage. Beyond that, we are always tapping into things to really professionalize that workforce as well, utilizing things like teach and wages programs, CDA programs. We've offered grant opportunities. we're also really partnering and working collaboratively with the Iowa Department of Education on professional development offerings that can span not just for the K-12 sector, but really looking at early education and prioritizing our childcare providers as those teachers. I would say that there's still a long ways to go, but I know that we're definitely starting to really make that connection in Iowa and really talk a lot about the partnerships between our child care providers and our teachers and educators as they go into that K-12 field.
And I see Elena nodding.
Yes, yes, such an important topic area and issue. And this was really strong in what was communicated to us through the listening sessions from programs and providers and the workforce, was that compensation really needed to be first out of the gate, right? We really needed to focus on the workforce within our system, both the current workforce that are working now in programs, and also creating a pipeline that welcomes new staff into our system. And so when we think about the expansion using the early childhood education endowment, our efforts include increasing the state funded rates for programs. This will help to bring more funding directly into programs because we've heard from directors and owners that they want to pay their staff more. Just the business model does not always work out in order for that to happen. So our strategy in Connecticut is to continuously increase the rates so that we can be aligned with the public school, kindergarten teacher salary, right? And working towards that and making sure that as we expand, we are equally thinking about the workforce and increasing those rates so that compensation could be an outcome of what occurs.
Very good. Well, you all are to be commended for your leadership, your innovation, and how you're driving these solutions forward at the state level. We know from our work at the commission and at the BPC that partly states are innovating because there's been a little stagnation at the federal level in recent years. Namely, the Child Care and Development Fund has stalled, and I think you would probably get agreement from both of you that you conceive of your state program as a supplement to federal investments, not in lieu of them. So here's your shot to tell the BPC Commission and BPC that is spending a lot of time on the advocacy side with Capitol Hill, what kinds of federal policies or funding reforms would enable continued innovation in states and leverage and scale your already successful models. Sherry?
Oh, that's a great question. So I would just really hone in on continuing to look at this as an everyone issue for solid economic growth. No two states are going to look alike. So allowing that flexibility in state funding while also ensuring decisions are data and stakeholder driven. Again, focusing back to a comment I made earlier that this isn't a red or blue issue, it's an everyone issue. Without quality, affordable childcare, communities all across the nation will find themselves in a workforce crisis. We need people to keep our economies thriving, and a key component everyone can agree on is that we need a place to grow the next generation of leaders while parents work and keeping that affordable. So letting states have that innovation in their funding streams.
Elena, your shot to tell the feds what to do here.
Well, I agree with everything that Sherry just spoke about. A couple of maybe specific things, right, is that Connecticut has really benefited, and I know nationally as well, from grant opportunities or funding opportunities that allow for these innovations, such as the Preschool Development Grant. Those are places in which state agencies and partners can really try something out, pilot it, and look to grow it. And so opportunities like that for funding innovation is critically important, along with really thinking about how do we incentivize and really move forward a more comprehensive approach to young children and families, right? It is about childcare, but there are also many other early developmental needs of children and families in order to ensure that children and families have the opportunity to thrive. So here in Connecticut, we look at Head Start as a model for comprehensive services and being able to see how can we innovate to have more of those comprehensive supports across our state-funded programs, for example, but for more children and families.
Well, we've done our best to incorporate the questions that we've been getting. I think everyone will agree we got a sort of a rich banquet here of ideas, practical advice, and a peek at solutions that are happening in real time. So here's the so-called lightning round, Elaine and Sherry. What of everything you said is the one piece of practical advice that you want to leave all of our viewers with? What's the one thing they should think about as they seek to move forward? Sherry?
Okay, I would say having a project manager, someone on the ground that can tell the story and speaks both economic development and childcare is going to move mountains.
Elena.
Say partnerships. It takes a village to make something like this happen in both of our states. And so, in a very diverse village at that, right? People come with different perspectives, different resources, skills, and expertise, and to be able to really hone that and use that to create that common vision and that work forward together.
Well, I thank you as one of the commissioners who's keenly interested in the solutions that you are advancing. Thank you for your leadership. Thank you for your service. And thank you from all of our viewers today. We, I think, all learned a lot. Melinda, I'll give it back to you.
Thanks so much, Susan. You did an amazing job facilitating that conversation. And thank you to our panelists for sharing their experience and insights about these bold new financing initiatives that their states have launched. This was like my dream conversation. I loved hearing about all of the detail of this and how you guys really implemented this. So I thought this was an amazing conversation. And as we've heard today, it's really critical that we're ensuring that families have access to affordable quality childcare. And that does require these innovative approaches, strong policy support, and critically, as has been mentioned, collaboration between different stakeholders, government, advocates, providers, and the business community and families at the core of that. As our BPC Commission on the American Workforce advances a national talent strategy, we remain committed to elevating the voices of practitioners and policymakers who are driving bipartisan and on-the-ground solutions. So would love for you to stay tuned for upcoming events in this series. In November, we'll turn our attention to learning and working in the age of AI, and the critical need for supporting our current and future workforce. And thank you all again for joining us. We look forward to continuing these conversations. Bye all.